Hi, I'm Dr. Rutuja from Parency IVF Hospital. Today we are going to talk about natural pregnancy. A lot of people come to us and say, Doctor, I want to conceive naturally. But if you ask them how to conceive naturally, they will not understand. So we need to understand how a natural pregnancy happens and what is the ideal time when you can try for natural pregnancy. And it is not that you have to do sex day and night or be with your partner day and night to become pregnant. No, you have to understand what is your fertile window period. So a woman who is ovulating every 14th day will get her periods every 28 days. So if a woman is having 28-day cycle, then that woman is ovulating on 14th day of her cycle. So if you are ovulating on your 14th day, then the ideal window of you trying to conceive is between anywhere 10th day of your cycle to the 18th day is the window of fertility. But a woman who is ovulating on 14th day can start trying for pregnancy from her 12th or 13th day, as sperm, when it enters the uterine cavity, it can stay alive for almost 36 to 72 hours. That is, sperm can wait for the egg to come, but egg waits only for 24 hours. So if the ovulation happens and if your tubes are open and they are functional, they will catch the oocyte and take it inside. At this time, if a husband and wife are together, the sperm will get deposited into the vaginal cavity. From the vaginal cavity, there is something called as a process of capacitation, and the sperm will get sucked into the uterine cavity through the cervix, and the remaining leftover fluid, which is called liquefaction fluid, which will come out of vagina. Only the sperm now ascend from the cervix into the uterine cavity, from uterine cavity into the fallopian tube. This journey is not easy for any sperm. It is just like a marathon of 1000 kilometers if you are running. That much of capacity, strength and speed is required in the sperm. If the sperm is that much capacitated, it will cross the hurdles of cervix, uterus and the fallopian tube sphincter to enter into the fallopian tube. At every level, the uterus and the tube act as a sieve so that only good quality, well motile and good sperms, morphologically good sperm reaches the fallopian tube. Once the sperm reaches the fallopian tube, if egg is already there after ovulation lying in the fallopian tube, the egg is fertilized by one morphologically normal sperm. If the fertilization happens, the embryo of day 1, that is zygote, is formed. From here, day 0 to day 5, the embryo grows into the fallopian tube, and then on 5th day, this embryo is sent into the uterine cavity. After the embryo enters the uterine cavity, this embryo gets attached to the uterine lining which was growing from day 1 of your cycle. Once the attachment happens, the blood supply or the nutrition, or you say life, comes to this embryo. Once this comes, your pregnancy test comes positive. That is, you have already missed your periods, because implantation happens on day 19 of your regular ovulating cycle. So, by 30th day, when you miss your cycle, if you do a serum beta HCG, it will come positive. That means you are naturally pregnant.
If you have any questions, connect with us on the displayed phone numbers or visit our website to learn more.